Good. I'm sure I believe most of the community opioid treatment programs and the providers in the community are very excited about this collaboration, aren't they?
It's an ongoing communication. Obviously, they are excited, and as new drugs like Suboxone come on board that are much more expensive than methadone, the discussion and dialogue with respect to taking arrestees off Suboxone and converting them to methadone will obviously become part of that dialogue. However, since both drugs are successful in helping them to prevent the sequelae of untreated substance abuse, I'm hopeful that we will be able to have a compromise in the sense of being able to recognize that as taxpayers' dollars can always give the most expensive medications when less expensive ones will do, we still have our goals, our mutual goals of sobriety and a continuity of care with respect to sustaining that successfulness that they've created in the community in treating their drug addiction.
Good. How about the issue of gang activities behind bars? Have you noticed any reduction in gang activities since you started the methadone program? Any relationship at all?
I don't think that we can actually show the data that says that we've decreased the gang-related drug trafficking per se, but I think that we can show evidence that we've decreased the violence associated with the drug activity that's gang-related. For instance, if you're placed in a holding cell and you go through the hypersensitivity of the anxiety and irritation associated with alcohol or drug withdrawal, you're more prone to be agitated toward correctional officers and fellow detainees and inmates, which sometimes results in violence. So by not having the agitation, by having people have a culture of humanity that they know will be brought to them with respect to their drug habit and their withdrawal, we've significantly reduced the number of direct assaults and violence related to substance abuse. When we look at drugs behind bars, we've recognized that heroin is one of the most common drugs used in the overdose cases that we have seen and treated. When we find inmates who are dead behind bars, it's directly related to heroin abuse. Since custody and medical teams now, along with mental health, are more aware of the opportunities to help them not only withdraw, but with our substance abuse programs, help them maintain their proactive approach to their drug habit behind bars. I think that we've been able to have a reduction in violence directly related to those treatment programs.
So if I have a friend who has a drug problem and happens to get himself in some trouble and ends up in the Maryland jail, or I know a family who has a member of the family who has a drug problem, and they got himself in trouble, and they end up in one of the Maryland prisons or Maryland jails. They're going to pretty much have their health taken care of, won't they?
Absolutely. The families should be reassured that Maryland not only fills the contractual obligation to support a humane approach to their chronic diseases, to the hepatitis C, the HIV, any kind of STD, chronic diseases, liver disease that's associated with those lifestyles. We understand that that is the population that we serve, and that by keeping them healthy as they do their sentence and pay back to the society what legislatively they've been obligated to serve, that they can do so with a commitment from the department to be proactive in treating their chronic disease, their addictions, and that we have and feel an obligation morally, ethically, politically, and contractually to help continue to support their sobriety. And we do that in a partnership with community providers, university providers, and a dedicated core of nurses and physicians who are obligated in their sense of spiritual and professional obligations to serve. We continue to deliver that public health message, and we will continue to support and advocate for their families and the inmates' right to health care.
Good. And if I have a sister who's been abusing heroin on the street and got herself in trouble and happens to be pregnant, and we all know that people who are abusing heroin and who are pregnant, and they have to be given methadone so that they don't lose their pregnancy, because if they go into heroin withdrawal, they will have contraction of the fetus and they may lose the pregnancy. So would they be given methadone to prevent that when they are behind bars in Maryland system?
Absolutely. For at least the 10 years that I've been privileged to be the Director of Clinical Services for the Maryland Department of Corrections, pregnant females were our first methadone candidates with respect to their withdrawal and support of the fetus and the maternal commitment to that fetus to be healthy. We're serving 2 patients, and we have an obligation to keep them both safe. So if their risk behavior, if in terms of life on the street or in the community, made them at higher risk for HIV or hepatitis, we test them for that. We nutritionally support them, and we help to make sure that these high-risk pregnancies, in partnership with the University of Maryland's obstetrical program, they're familiar with high-risk deliveries, and these patients are deemed high-risk, and we partner with them and an on-site OBGYN provider to give them that service.
Very impressive. So it's no wonder then that a Russian delegation actually came all the way from Russia to visit your program and learn from what you do here in Maryland. Is that true?
Yeah, we were privileged, along with a partnership of BSAS, to entertain the Russian delegates, and they specifically sought out our model of not only alcohol and substance abuse, but our approach to chronic diseases in general. But specifically, they were impressed with our substance abuse-related program and the support systems in place for detainees and inmates.
Thank you very much, Dr. Baucom, for giving us the opportunity to come and learn about the Maryland healthcare system, especially how you take care of drug offenders that happen to be arrested for drug-related offenses in the Maryland system. Hopefully, if we want to learn more, if we have more questions next time, we hope you'll give us the audience.
Absolutely. If there's not anything that we are not willing to do to support healthcare, a public health mission of the community behind bars, and if they feel like their sons, daughters, cousins, husbands don't have hope behind bars in terms of healthcare and substance abuse, I hope that you're as excited as I am to know that that opportunity is there. We've sustained it. We're going to improve it even more. And we want to make sure that that's the least worry of their family's problems when their son or daughter is incarcerated.
Thank you again for being with us, Dr. Baucom.
Thank you.